integrated approach towards healthcare. That means looking at energy work, nutrition, musculoskeletal work, and indeed medicine. We've always felt medicine has a huge role to play, and our policy was always that to see the value of what medicine has to offer. And in the society, in our complex society today, we see the need for this is greater. Looking at the problems that are there regarding stress, the increases in cancers, the increases in neuromuscular disorders, the increases in coronary conditions, the huge amounts of problems and the stresses that people are experiencing out there today is causing a huge amount of issues. For a number of years, we felt that if we could get some program that would incorporate everything, that we would be able to provide for our society an understanding, an awareness, a system, a skill, a technique, whatever it would take to give them control over their own health. And that's what society needs. Society needs an education. They need to be re-educated. They need to understand that if we want to be healthy, that it's not a quick fix. It doesn't come in a bottle and it doesn't come in a pill. It doesn't come in somebody waving their hands. It comes when people are given the proper tools and techniques to understand how the body functions, take responsibility and take control of it. For a number of years, I had lots of patients coming to our clinics and talking about the wonderful work that Mr. Sherif Sultan was doing in the Galway Clinic and in the university. And we always felt that, I suppose in a way, he kind of strayed outside the box a little. And it's always nice to know people who are willing to stray outside the box a little and to impart knowledge that's relevant, that might not necessarily fit into the allopathic or the orthodox model. And that doesn't mean that the orthodox model doesn't work, because it actually does. And we're very fortunate today to have somebody of the stature of Mr. Sherif Sultan, who's a cardiovascular specialist and surgeon in the Galway Clinic and University, to have him here to express to you what he sees in his work today, how he sees the need for an integrated approach, and his experience in dealing with so many people. And obviously, of course, he's going to talk to you about the way that a lot of problems have been treated today through medicine, and in particular in his field, the area of statins, which are cholesterol-lowering medication. I was just saying, even this week in my clinic, 25% of people were coming to the clinic on statin medication. It's not our policy to take anybody off that, but the key is to draw their attention to sometimes the side effects. And many of these patients this week, all of the people who were coming to see us this week on that medication, reflected symptoms of neuropathy, or cardiovascular problems, memory loss, all of different symptoms like that. And it can only beg one question: and why are people having these symptoms when there's no apparent reason? And there's a lot of information out there about the effects of statin medication. And while it has a role to a certain degree in our society, and all medicine does, we need to look now at the possible effects of these types of medications that could contribute to problems. So with that in mind, the opportunity to invite Sherif to talk with all of you today is in a way groundbreaking, because very little, or very often, the type of work that we do is dismissed. But we're at it for so long now. We've 22 years. We've established a credibility of what it is that we're about within our community, and we take a very professional approach to this. So that is why I think you're going to find what Sherif is going to talk to you about this morning very beneficial. And on top of that, certainly for me in my clinic, to have somebody like Sherif to be able to refer patients to, who are on these medications, who have particular cardiovascular problems. Certain amount of work we can do, but to be able to refer somebody to somebody of Sherif's stature is going to be hugely important for me, for you as plexus therapists as well. So without further ado, I'm going to invite Mr. Sherif Sultan to the stage. Thank you.